I've been talking about menopause and all the things. We've covered a lot of ground, and then I've kind of come back and revisited a few things and gone into a little bit more detail. And I just want to say thank you for folks that take time out of their day to join me, to ask questions, to bring their expertise. There's been some other folks that have popped in, and I so value and appreciate folks spending their time with me. So thank you, first of all, for everybody that's supported this and shown up and hopefully shared with a friend and invited them to come and listen or catching the recording. So first and foremost, thank you for that. I really do appreciate that. I think it's important to normalize the conversation around women's health in general, and even more so around menopause. I feel strongly that healthcare is not always paying attention as much to our health, our risk, and mitigating those risks, and educating and supporting us to ensure that we live a high quality of life for as long as we are blessed to be on this earth. And for me, it's important to raise that awareness, and especially around menopause. It's got a lot of tainted history when it comes to the medical community, and making sure that women in general, Black and brown women, understand their risk and how to manage that, right? What should you be looking for? What are your options for treatment? How do you live a high quality life for as long as you possibly can? And then more importantly, in my running group, we're all sort of the same age, rounded about, in our 50s. And we're talking to our girls. My girls are a little young now. They're 11 and 7, so it's a little young. But we didn't get that conversation. I didn't get that conversation from my mom. My mom, died pretty young. I didn't get it from my aunt. So now it's my responsibility to make sure that I'm passing that on to my girls, and that if you're listening and you have kids or you have nieces, or you're passing that information along so that those coming behind us don't have to struggle and don't have to want for information and look for information. So that's kind of the motivation for this, is to make sure that we're having those conversations. So just make sure we're having these conversations and making sure that this is an open dialogue amongst our age group, and then more importantly for all the young women and girls coming behind us, so that they don't have to go through all this, what is this menopause craziness that's happening to me? So before I jump into, today what I was going to do is really dig a little bit deeper into brain health as it relates to perimenopause and menopause, some of the symptoms, and then what do we do? And I in my opinion, if we start these conversations early, because it's what we do in our 30s and our 40s that really create the life we want in our 60s and 70s. Obviously, it's never, ever, ever too late, but it's what we do in our earlier years that really sets us up for the quality of life we're going to have as we approach menopause and then in our postmenopausal years. And this particular topic, while I'm going to frame it in the context of menopause, when I talk about treatment and brain health, this is a universal thing. It's not just for women, and it's not just about menopause. Obviously, the decline in estrogen is going to affect us in sort of a multitude of ways, but the treatment strategy and the things to think about and the things to put into place really are not just for women, right? It's for both. It's for men and women. So if, John, hang in there, or it's not just for us, I guess, is my topic. So that's my goal for today. What I wanted to do, there was something brought up when we talked last week. So we talked about some of the symptoms related to genital urinary syndrome and menopause, and specifically around chronic UTIs and what do we do to treat those. And we talked about, are there, using vaginal estrogen and, pelvic health, and, making sure we're treating the UTI if there's truly a UTI. But if we're getting them recurrently, making sure we're digging a little bit deeper, because there could be something else going on, especially if you're treating a menopausal and postmenopausal female. So one of the things that came up in that conversation was intravaginal probiotics, which I thought I hadn't heard of that as an option. So I did some digging between last time and today to understand what are the options around intravaginal probiotics. Are they an option? What are we treating? Those sorts of things. So genitourinary syndrome in menopause, again, as estrogen declines, the vaginal tissue changes, right? The elasticity of the tissue changes. The estrogen receptors are decreasing, so then you have thinning of the skin. You've got some atrophy that can happen. There's decreased blood flow. All of that creates a constellation of symptoms, anywhere from vaginal dryness, painful intercourse, burning, itching, burning when we urinate, frequency, urgency, and then putting us at risk for frequent UTIs. So that's kind of the syndrome. It can be any or all of those. And then we walk through what are those treatment options associated with that. So when we think about intravaginal probiotics, it's just what it sounds like, right? So we're trying to reintroduce or to improve the bacterial strains in the vagina to decrease either symptoms, potentially in the vagina. So we're talking, whether that's bacterial vaginosis, yeast infections. And then the question is, does it improve any of these genitourinary syndrome, any of these symptoms, associated with genitourinary syndrome of menopause? And as far as I could see doing some research, where it's been studied is really for vaginal concerns. So if we're treating women for recurrent bacterial vaginosis or recurrent yeast infections, potentially using intravaginal probiotics in conjunction with our typical treatment can be more beneficial. Maybe even in some cases for prevention, if you're seeing women recurrently for coming back for BV or coming back for yeast infections. So at least from what I could see, it's really being used as an adjunct or in addition to, antibiotics associated with those two conditions, or potentially as prevention if someone's having recurrent bacterial vaginosis or yeast infections. I didn't see, at least in some of the research that I did, that it's being used, again, for a treatment option for genitourinary syndrome of menopause. I think when it was brought up, I was talking about frequent UTIs. And when we give women antibiotics for urinary tract infections, it cleans out the beneficial bacteria in our gut. And then I always talk to anybody that I give antibiotics for, talk to them about the risk of diarrhea, the fact that we're cleaning out your beneficial bacteria, and in some cases, it increases women's risk of getting a yeast infection, right? Because now we've changed the flora in and around the vagina. So in that context, I can see how, augmenting that antibiotic treatment with some intravaginal probiotic to prevent potentially a yeast infection as a result of the antibiotics that we've given for a UTI potentially. So it sounds like that's an option. So that was actually pretty interesting. I hadn't seen that, which is also why this is so amazing. I am the first person to raise my hand and say, I don't know it all. I do not. I love to learn this stuff and I spend time reading and I love it. But man, I am not an expert in all things. So it's so cool when somebody jumps on and asks a question, because then it forces me to go back and read and sort of stretch my knowledge and stretch my understanding. So thank you, Dr. Bose, for that. So in those sort of contexts, if I'm handing out a probiotic, I'm handing out an antibiotic, usually I'm asking them, do you get a yeast infection? If they're like, yeah, every single time, I'm handing out the medication for a yeast infection. But, again, maybe changing my clinical practice, I say, hey, should I be handing out an intravaginal probiotic? So thank you for that. The other thing that came up was the use of L-Lysine for immune function and weight loss. And again, looking at the research, L-Lysine, which is an essential amino acid, can be used. It's an anti-inflammatory for sure, so reduces inflammation, and it can increase our immune function. I did not see enough data to support it in the realm of weight loss. So from an immune perspective, yes. And I am very much a proponent of doing the foundational things. And even when I talk about, treating women, going through perimenopause and menopause, there's foundational things that I really try to encourage people to put into their life. And those are we eating the foods to support optimal health? Are we sleeping in a way that supports optimal health? Are we moving in a way that supports optimal health, hormonal health included? Are we consuming risky substances that may be counteracting all that other good work that we're doing? Do we have community with like-minded people? Are we managing our stress? Because We cannot avoid it. It is here, but what are we doing to manage that? So those foundational things are paramount. Obviously, there's no perfection in anything that we do, but laying that foundation is the most important thing. Then if we want to use supplements, exactly what it sounds like, to supplement what we are doing, yeah, maybe there's some opportunity for that. But I think really working and putting the effort in to do the foundational things, eating foods that build good gut health, which is where your immunity lives, right? The bulk of our immunity happens in our gut. So we want to be eating high nutrient dense foods that are going to feed our gut bacteria, right? It's the fermentation of fiber that creates healthy gut bacteria, butyrate being one of them, that lays that wonderful mucus lining that protects our gut and everything that we're putting in our gut from our bloodstream, where it creates an immune response or a huge inflammatory response. So eating nutrient dense foods, high fiber foods, staying away from the processed, staying away from the highly refined, staying away from alcohol, creating that gut health as a foundation. And then if we need to, we can supplement with something, and L-Lysine is definitely one of those things you could consider in regards to improving your immune function. But if we are, consuming the highly processed, ultra refined, we're drinking alcohol, and then we just throw some L-Lysine on top, I don't think you're going to get the benefit you're hoping for, right? So it's the foundational things first. So those were two things I wanted to just spend a couple minutes talking about that came up last week. And this is where I wish I could see people, right? I wish I could, and I don't know, at some point I'll do a Zoom, I don't know, where we can see each other, although sometimes we're like, I don't want to be on camera, but just so it was a little easier to have a little bit of dialogue and field some questions. But don't hesitate, if you got questions, pop them in there, they'll show up and I'll try to get to them. So for today, I wanted to get a little bit deeper into brain health and crazy things, right? So estrogen starts to decline, and that is, starting perimenopausal, and that could be, early 40s, it can be late 40s. You start to notice symptoms. You're like, what in the ham sandwich is going on? There's a whole constellation of things. And then you get into menopause, a year without a period, and then kind of that postmenopausal period. So that decline in estrogen, we've chatted a little bit about, can cause some brain fog, can cause some depression, worsening depression. It can, change our mood, our ability to sort of manage the things that are coming at us, cognitive decline, those sorts of things. So it is a risk. I mean, it's a risk for everybody, but again, that loss of estrogen just puts us in again, sort of this unique category. And there's really three things when it comes to estrogen decline. It's our brain, it's our bone, and it's our heart. Those are the three things that we really work to try to optimize as we go through this. And again, like I said in the beginning, the things that really create brain health, it's not just unique to women, right? This is men and women. It's just, again, I talk about it in the framework of menopause. So when it comes to brain health, the earlier we start, the better. Really, in healthcare in general, things take time, right? We start to show some of these things at a particular time in our life. Again, 40s, 50s, we start, oh my gosh, I'm getting high blood pressure. When it comes to women, it could also be because of the decline in estrogen. Oh my gosh, my cholesterol is starting to go up. I've been doing the same thing my whole life, and now all of a sudden I've got high cholesterol. What the heck is going on? Well, for us, it may be, again, that dip in estrogen, that protective effect. Our cholesterol, or LDL specifically, starts to go up. But that stuff, some of that is lifestyle that we've been living, right? And then for us, compound that by the loss of estrogen. So that it takes time. Insulin resistance takes time. It does not happen overnight. In traditional healthcare, again, we're watching this fasting glucose, or we're watching hemoglobin A1C, but your fasting insulin can have been rising for 8 years, 5, 8, 10 years prior, before your fasting glucose. And even that, your fasting glucose has been rising for a few years, and we just watch it tick, 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 and then all of a sudden it's over 100, and then we get the hemoglobin A1C, and it's like, oh my God, you're pre-diabetic. Well, yeah, it was happening 10 years ago. So the things we do earlier set the stage. So what does that mean when it comes to brain health? The same things we talk about for heart disease, high blood pressure, are the same things for brain health. If you think about it, your brain really is fed by vessels, right? You got to get blood to the brain. You've got to get nutrients to the brain. So the same things that we do to manage our blood pressure, keep the vascular system healthy, keep it to the point where you don't have this outrageous inflammatory process going on, is the same recommendation for the brain. The same things we talk about to keep your cholesterol down, keep those LDL particles low, keep that ApoB low, are the same things that are going to confirm benefit to the brain, because it's the same vascular system, right? It's the same pipes. The pump that feeds the pipes that go everywhere, whether it's your kidneys or your brain, it's exactly the same. So the same recommendations to keep the heart healthy, to keep your vascular system healthy, to keep your blood pressure down, lower your risk of heart disease, the exact same stuff for the brain. So what does that mean? It comes back again to your nutrition. I feel like people are going to stop listening to me at one point because they're like, oh my God, this woman only talks about nutrition. But I firmly believe that it's the thing we do more often, right? Most people, some people do time-restricted eating. They have a feeding window of whatever, 8, 10, less hours. But what are we eating during that feeding window? If we eat 3 times a day, those are 3 opportunities, right, to confer health. If we're snacking in between, those are additional opportunities to confer health. So it's, again, those foundational things that really create health, but it's the exact same thing. In healthcare, we tend to, unfortunately, look at people as parts, right? Ooh, you've got diabetes, you need to go see your endocrinologist. Oh no, you've got high blood pressure or you have heart issues. Oh, you need to go see your cardiologist. Oh, you've got brain stuff. You need to go see a neurologist. But in fact, it's all the same thing that's causing all 3 of these things. So if we just treat that, can we lower our risk of all of that? And I personally say absolutely, unequivocally. Nutrition is huge. Are we eating, again, nutrient dense, high fiber foods, low to no processed foods? Watch the refined sugars and the refined carbohydrates. Those things are going to confer health, gut health, immunity, inflammation. It keeps it low. It keeps that inflammatory response through the body low. It keeps clean blood vessels, the same thing that feeds your brain. So it's the same thing for brain health. So nutrition is huge. The other thing is sleep. Sleep is profound when it comes to your brain health. So when we sleep, and I think I touched on this in some of the other talks, when we sleep, that's when we sort of encode our memory. That's when your brain does its like rinsing and detoxifying. So if we're getting fragmented sleep, if we're not getting restful sleep, or if we're getting less than 6 hours of sleep a night, our brain is not doing all the repair, detoxifying that it needs to do in order to build good brain health. And it takes years. I think I did a talk or I wrote, I can't remember, on Alzheimer's, and it was probably close to the time when my grandmother passed away, because I started reading a lot about it. I mean, I talk about nutrition all the time, and really digging into it is, we have these medications for Alzheimer's. We're not reversing the disease. Again, we're treating symptoms. And Alzheimer's doesn't just happen overnight. It's the stuff that we did in our younger years. We've been, the cognitive decline and the slow micro damage in the heart and the deterioration in the brain has been happening for 8, 10, 20 years, 30, before we start to see symptoms related to dementia, Alzheimer's dementia being one of them. So it's stuff that we're doing, again, in our 30s and our 40s that's going to create the health in our 50s, 60s, and 70s. So nutrition is huge. Sleep is profound when it comes to that. Alcohol, or the choice to drink or not drink, is profound when it comes to brain health. Alcohol, as we get into our later years, we do not metabolize as well. It generally will affect us more. It certainly disrupts your sleep. It is universal. Everyone that I've talked to that I take care of that drinks alcohol, is they see their consumption decrease, or they choose to walk away from it entirely. They the number one thing they tell me is their sleep improves. Most people, if you're drinking at night, you may fall asleep better, but you do not stay asleep and you do not get restful sleep. And when they reduce that alcohol consumption or they choose to just walk away, they notice the first thing is their sleep improves. And again, we know sleep is huge when it comes to brain health. So sleep is paramount, nutrition is paramount. Then we talk about exercise. Again, in the context of heart disease, in the context of high blood pressure, exercise is huge. Again, when we think about perimenopause and menopause, we have to shuffle the deck a little bit. And I think I've talked about this even for myself. If we were, into like the cardio and doing all of that when we were younger, as we get into our perimenopause and menopausal years, we have to rethink how we exercise or how we move our body and what we focus on. Strength training becomes more important. Doing more short bursts of effort at higher effort becomes a better metabolic strategy for us than the distance running, than the, just straight out cardio steady state. So mixing some of that stuff in there is going to be more metabolically beneficial for us as our level of wisdom increases. And then strength training becomes profound as our level of wisdom increases. So our exercise may look different, or it should start to look different as we get into our later years. I don't want to say later. I don't feel later. Do y'all feel later? That was bad. Don't say later. As we get wiser in our years, our exercise has to change. It's interesting. I was talking to a patient yesterday, as a matter of fact, and we have to be open to mixing things up. And I told her, as she's doing something, you always want to be a little, what did I say it? Comfortably uncomfortable. We always want to be comfortably uncomfortable. If we're doing an activity, and I'm talking specifically about exercise now, if you're doing an activity, whatever it is, and it's a breeze, and at the end you're like, oh, that was easy. Well, it depends on what we're doing it for, right? If you're going out for a walk with your girlfriends and some family or friends, and it's just conversation and it's community, sure, you don't need to be, comfortably uncomfortable. Get comfortable? Yes, exactly, correct. But if we're out there and this is, exercise, and I know some people have kind of an aversion to that term, but you're out there for activity for the purpose of building metabolic health, putting a chip in the bank for your longevity, then we want to be comfortably uncomfortable. And if it becomes easy, then you got to shuffle the deck. You got to mix it up. I wear a weighted vest when I know I'm not going to be able to really jam out some sort of physical activity. It's just a little bit of extra load through my normal day. I'm doing whatever I do today, but I'm carrying 5 extra pounds on my back. Just something, right? If you're going for a walk and the walk is getting easy, well, find another route. Put some hills in it. Change your pace. Do it in a different direction. Carry some hand weights. Put on a weighted vest. Do something different to shuffle the deck so that you're constantly looking for something that helps you be comfortably uncomfortable. It doesn't have to you don't have to go to the gym and crank it out, although I want you to strength train. Think about where you can do that and how you can do that. But be open to doing it different. And you might have to do it different a couple times, right? It's like, okay, I'm sort of figuring out what I need to do right now. That's probably going to look different in a few years. I might have to shuffle the deck again, but that's okay. I think that's the beauty of living in this wonderful body that we've been blessed with, the health that we've been blessed with. It's a gift, right? To be able to get out and do these things and recognize that we can kind of shuffle the deck and still make ourselves proud. So when it comes to exercise, comfortably uncomfortable. Yes, squats when you brush your teeth. And there's so many different squats you can do. Like that's what I'm doing now, right? I got used to just doing the straight up and down squats. So you can do sumo squats. I do alternating legs forward. I do alternating legs backwards. Yeah, you can mix up your squats, right? You could change the pace of the squat. You can go down for 3, come up fast. Down for 3. There's so many different ways that you can shuffle the deck and just put it in wherever you can get it. So brain health. Nutrition is paramount. Yes, I like it. That's some coordination right there, I feel like. I feel like I can just sort of zone out and brush my teeth and squat. But doing your hair and squat, that's impressive. I like that. That's some good, like, cognitive. It's like, doing the crossword puzzles. It's like, keeping the brain going. I love it. So nutrition, huge. Sleep, oh my God, sleep. I ended up, and I think I've talked about it before, I bought an Oura ring because my sleep was like garbage. It was so bad. I felt like my nutrition was good. This was, years ago. My nutrition was good. I was exercising. I felt great. But my sleep was horrible. So I ended up, off topic, what is is it backwards? A Morpho? So this is a fixed weight. It's 5 pounds. So the research says at least 10% of your body weight, right? To really kind of add that little bit of stress to the bone. Again, if we're talking bone health, perimenopause, menopause, like 10% of your body weight to just add that little bit of bone stress. There are some other options for weighted vests that you can change the weight. They're a little bit heavier. So it's kind of where you want to start. I tend to do this because then I wear it when I work, and it's a little bit more streamlined, so I can kind of fit it on my I usually have a fleece on when I'm working. So it's just a little bit more low profile. I've tried to run it a couple times. Whoa, that was tough. So yeah. Stress moment, exactly. So it's a little bit more low profile. Some of the ones that have a bit more weight, they can get a little bulkier. But yeah, weighted vest is a great option. If you're out for a walk, walking the dog, if you have a dog, you just throw your vest on. Or running errands on the weekend, throw your vest on. Out there doing yard work, throw your vest on. They're fantastic. So I encourage people to look at that. So my sleep was in the toilet, and I couldn't wear my watch, so I ended up investing in an Oura ring, which has been profound for me. So the Oura ring has been amazing, O-U-R-A. It's been amazing because if you like data and you're going to use the data, I would highly recommend it. And it turned into helping me monitor my sleep, right? Am I getting enough? Is it good quality sleep? What am I doing that, the timing of when I go to bed, how many hours is kind of that sweet spot. I was staying up and snacking at night. I had some really I had some unhealthy habits that I work to continually refine, and at times I slip back into them, right? I slip back into staying up after I put my kids to sleep, and I'm staying up late and I'm working, but I'm half doing other things. So then I have to kind of get back into it. The other thing though that the Oura ring really helped me with is monitoring my heart rate, my resting heart rate. I think I posted about that the other day. And monitoring my heart rate variability. So those two for me are just really great, all-encompassing markers to know how all of the pieces of my health are coming together. Because my sleep, how active I am, how much rest I get, when you put all of that together, for me, my resting heart rate and my heart rate variability are two really easy ways for me to know, am I dialed in? So I look at that periodically. But when I bought it, it was really for the sleep. And then you can do little tests, right? On the days that I wear my weighted vest, I can put that in as a little tag, and I see, okay, did that change anything? So you sort of run your own experiments on yourself. So I think it's fantastic, and I don't get anything from it, but I think that it's a great, wearable that can give you some really good information, assuming you're going to use it. So if you like that data and you're going to use it, I would recommend it. So nutrition, sleep, whether or not we choose to use alcohol or drink alcohol, that has a huge effect on our sleep. And then we talked about exercise, right? Motion, being comfortably uncomfortable with that activity. And then it's like, okay, what are the supplements that are out there? And are there additional tests that I run? So when I look at somebody, and we're talking again brain health, number one, foundational. How are you living your life? Tell me all the things. What do you do with your day? What are you eating, drinking? How are you moving? Do you manage your stress? Who are your people? And do you stay in touch with those people? And then we look at labs. So I'm checking their cholesterol. Again, if you've been listening to me, cholesterol is not everything, right? We look at their LDL, and I explain to people that when we get a traditional lab, They're estimating the amount of cholesterol in that LDL particle, but what is more important is the number of LDL particles, which is an ApoB. So looking at your ApoB, looking at your lipoprotein A, in addition to a standard lipid panel. If someone has risk factors for Alzheimer's, meaning family members of theirs got it super, super young, I talk to people about, do they want to look at an ApoE? That is a lengthy conversation. Doesn't necessarily mean they're going to get it. So we have to be careful when we order these things, that we're having a really good conversation around what are we hoping to gather from that information? What are we going to do differently with that information? Because I don't want people to, again, right, just say, oh, I've got 2 copies, therefore I'm definitely going to get it, because that's not the case. So we need to be mindful when we order those things, but that is a test that I've ordered. And if a patient desires that and we've had that conversation, that's something I talk to them about. And then we talk about what are the supplements, right? Omega fatty acids. Turmeric is anti-inflammatory. Those are 2 big ones. Creatine is another one that has been well studied and is beneficial not just for muscle, but also for cognition and brain. So those are 3 big ones that I talk about. Where's your vitamin D? Those sorts of things I talk about as well. So those are things around, again, supplements on top of the foundational things when it comes to your brain health. So you can certainly talk about that in the labs. What are you looking at with your doc, and what are you optimizing, and what are you measuring? Managing your blood pressure if you have high blood pressure, because again, it's about flow to the brain. The brain is a very tightly regulated space. So if we have hypertension or high blood pressure, that is going to affect our brain health. So managing that high blood pressure with the same foundational things we talked about. So really making sure that all of that is taken care of. And the earlier we start to do this, the better things will be. Because again, disease takes time, right? You don't just wake up in your 70s with Alzheimer's or slowly, presenting dementia. Some of the lifestyle, and whether there's a genetic predilection, lifestyle can feed that, called epigenetics. So what we're doing in our 40s or 30s, 40s, 50s creates our retirement, or creates, life later years. So just as a summary, brain health. Again, it's in the context of menopause, but this is men and women. Foundational things, nutrient-dense foods, high fiber, stay away from the processed, highly refined, added sugars, creates an immense inflammatory response in the body, raises your blood pressure, increases your risk of heart disease, increases your risk of dementia. Eat foods that are going to confer good gut health. Then the next thing becomes your sleep. Sleep is profound when it comes to brain health. Getting at least 7+ hours of sleep, restorative and restful sleep, because your brain does all of its memory encoding and detoxifying in your sleep. So you got to get that. Whether or not you choose to drink alcohol is going to disrupt your sleep. It's the number one thing people tell me improves when they choose to stop drinking alcohol. Their sleep improves. Again, sleep is paramount. So whether you choose to drink alcohol also changes your gut health, which is immunity, which is inflammation, right? So all it comes back to the same thing. Then we talked about exercise. Comfortably uncomfortable. Shuffle the deck. If it's getting too easy, shuffle the deck. Change something. Throw on a weighted vest. Change your route. Run hills. Do sprints. Add 5 pounds. Shuffle the deck. Comfortably uncomfortable. And then supplements. So you've got the foundational. Then you add supplements, because it's supplements. It's not to take the place of, right? So omega-3s, turmeric. Where's your vitamin D? Taking a vitamin D supplement. And then creatine, right? Whether or not you choose to check an ApoE, right? Talk to your doc. If you truly have early onset Alzheimer's, dementia in your family, have a conversation whether that's appropriate. What does that mean? If you have a double copy, if you don't, right? So that's important. And then where's your cholesterol, your LDL, the number of those little guys? Those are the bad actors. Your ApoB, your lipoprotein A. Where's your vitamin D level? those sorts of things. So those are the things to talk to your doc about when it comes to brain health. And start cashing the chips now. Start putting those little, pennies in the piggy bank that confers brain health for yourself, so that in your 70s, your 80s, you're still at it, right? You're still getting it done. Thank you, everybody, for joining. I appreciate you. Share it with a friend. Tell somebody to jump on. We had some new folks today, so welcome. If anybody's in Portland, I think, the sun was shining when I came into work today. Hopefully it's going to shine today. And we'll continue to get outside, get some vitamin D. All right. Have a fantastic day, everybody. Take care. Bye-bye.